episode 9 of In Clinic. I'm your host, Danelle, registered pharmacist and lead practitioner at Clinic One Medical Aesthetics.
And I'm Alex, co-host and marketing specialist at Clinic One.
On today's episode, we're going to be discussing some age-related skin changes that we all undergo, starting in our late 20s and through to our 50s, 60s and beyond. We'll discuss some of the treatments that you can undergo and protocols that you can follow to help slow down the signs of skin aging.
So what are some of the key skin concerns for individuals in their 20s, and is there any treatment that they can undergo to address this?
So some common skin concerns for people in their 20s are things like acne, uneven skin tone, and early signs of sun damage. Now, things like acne can be addressed with a really good skincare routine. It depends on the severity. Sometimes there might be a need for prescription medication to treat severe cases of acne. Things like uneven skin tone and early signs of photo damage can be treated with things like chemical peels and laser resurfacing or cryopen.
So how do lifestyle factors such as sun exposure or skincare habits affect people in their 20s, and is there any measures that they can take?
So sun exposure, the skincare routine that you have and your daily habits all have a massive impact on your overall skin health. So young people should be focusing on having a really thorough skincare routine, including the use of an SPF cream during the day and a retinol serum or some sort of a retinoid at night to help maintain the integrity of their skin and prevent any signs of immature aging and things like photo damage.
So can you discuss the role of collagen production and decline as we enter our 30s?
So collagen production begins to decline as we enter our late 20s and early 30s at a rate of about 1% a year. Now, this is what contributes to the loss of elasticity and firmness in the skin, and it contributes to the formation of fine lines and wrinkles. So as time goes by, the more and more that we age, the more and more we're losing this collagen and elastin in our skin.
And what treatments are beneficial for maintaining a youthful appearance in your 30s?
So treatments like Botox, skin boosters, dermal fillers, and microneedling are really good at reducing the appearance of wrinkles, improving skin texture, and restoring volume. Now, for somebody in their 30s, I would recommend that they start taking a high-strength marine collagen supplement, as there's a lot of evidence that shows that taking these marine collagen supplements for just a few weeks has a really positive impact on the levels of collagen in the skin.
So what advice do you have for individuals in their 30s who may be considering aesthetic treatments for their first time?
Now, if it's somebody's first time stepping into the world of aesthetics, I'd recommend that they start with a minimally invasive procedure or start really, really small and just ensure that they maintain good skincare habits to ensure that they're optimizing their results long term.
As people enter their 40s, what are the most notable changes in their skin appearance, and how can aesthetic treatments address these?
So some common changes include things like a loss of skin elasticity, increased pigmentation, and deeper wrinkles. Now, things like Botox, skin boosters, mesotherapy, and dermal fillers can help address some of these skin concerns.
So how do factors like hormonal changes and environmental stressors impact someone's skin health in their 40s?
So hormonal changes and environmental stressors can contribute greatly to things like dryness, dullness, and accelerated aging of the skin. Now, I spoke in depth in episode 6 of this podcast about how menopause has a role in skin laxity and the definitive role that estrogen plays and how important it is in maintaining collagen and elastin levels in women. So a woman who is perimenopausal or who has been through the menopause is likely to notice some quite drastic and high level changes in the appearance of their skin. And this is where aesthetic treatments can become really, really useful, and the use of oral collagen supplementation can become really important.
So moving beyond the 40s, what are some common aesthetic concerns for people in their 50s and beyond, and how do treatment options differ?
So some common skin concerns once we get into our 50s and move towards our 60s are things like a large increase in skin laxity, so tissue begins to sag, and we find that we have quite a lot of volume loss in certain areas where they might have been more voluminous when we were a bit younger. The treatment options for this don't really vary once we get to this stage in our life. They tend to be quite similar from 50 to 60 onwards, but it all depends on what the person's individual goals are and obviously how lax their tissue is and what they're trying to achieve and what kind of treatments we might need to use to address certain areas of concern.
Can you discuss the role of dermal fillers and skin boosting treatments in addressing age-related volume loss?
Injectable treatments like dermal fillers can restore lost volume, smooth wrinkles, and soften the appearance in older age groups, leading to natural results with minimal downtime. Skin boosters can also restore lost volume, and they act as like a deep moisturizing agent to smooth out wrinkles and improve skin laxity.
What considerations should individuals in their 50s and beyond keep in mind when selecting aesthetic treatment?
So considerations for these older age groups include things like skin laxity and what might actually be achievable. So if skin laxity is severe, then it might be really difficult to achieve that optimal or outstanding result that most people are hoping for. My advice would be to search out a practitioner who's skilled enough to give you a result that you'll be happy with, but is open enough to have that conversation with you and set a realistic expectation about what might actually be achievable with aesthetic treatments.
What role do maintenance treatments play in prolonging results in older patients?
So, maintenance treatments such as top up injections and periodic skin rejuvenation treatments can really help maintain results as we age. But it's really important that someone has a good skincare routine, including the use of sun protection, to try and maintain and prolong skin integrity over time.
Lastly, what advice do you have for our listeners who may be considering aesthetic treatments but are unsure on where to start or what treatments may be suited for their age group?
So start out by researching the practitioner and the clinic that you're interested in visiting and book yourself in with a consultation with them first so that they can understand your needs and your goals. It would be a really good idea to start off with a minimally invasive procedure before exploring some further options for more advanced treatment based on your specific needs and requirements. If you'd like to put yourself in for a consultation with us or to find out more about the different treatments that we offer, hit the link in the description, which will take you directly to our link tree, where you can contact us via WhatsApp or you can download our treatment guide directly to your device.
Don't forget to like and subscribe if you enjoyed today's show. Hit the bell if you're watching on YouTube to get notified when our next episode is out, and leave a comment if you have anything interesting to say. Thank you for watching.